For the next pathology we should be talking about is meningioma. We'll talk about the pathology of meningioma. So meningioma is kind of like, a tumor in the meninges, right? Meninges is that tissue that is covering the brain down to the spinal cord. So you can see that there's a growth there. All right, you can have a tumor arising from that tissue of the body. So that's what we call a meningioma. So what is a pathology? All right, so just so you know, they are the most common intracranial tumors. That's like tumors that could actually occur in the brain. Meningiomas are very, very much more common, right? So they typically arise from the meningotelial, that's the arachnoid cap cells of the meninges. They are usually slow growing and benign, but their behavior and histology can vary widely. Okay, so general pathology, like where do they actually originate from? They originate from the meningotelial cells of the arachnoid matter. Okay, location, often dural base, found along the cerebral convexities, right? Falx cerebri, sphenoid wing, or spinal cord. Growth, typically extra-axial, that's outside the brain tissue. Okay, so it usually compress the adjacent structures. Okay, so consistency is firm, is rubbery, sometimes gritty if there's calcium deposition in it. Okay, so microscopic features is architecture. That's like if you observe it on a microscope, which I didn't actually bring a picture, but you see that there's whorls, there's sheets, nest of what meningotelial cells. So cell morphology could be round to oval. There's what deposition of eosinophils. The cytoplasm is kind of like eosinophilic. All right. Then indistinct cell borders. I have to tell you that what the cells are now losing their borders. There's no arrangement again. So special features, you can see Psammoma bodies on histology, intranuclear pseudo-inclusions, syncytial appearance in classic meningotelial type. Right, it's a meningioma arising from the meninges, meningotelial cells. Right, so this is a grading, all right, which I'll actually spend time and talk about especially. But just know that we have the benign grading, we have the atypical grading, we have the malignant grading. Okay, all right. So clinical features, the person will be having headaches because of increased pressure in the brain. There's seizures if some nerves are compressed and all of that. The focal neurological deficits, that means the person will be having issues depending on the part of the brain that is affected. Okay, so that's just it for the pathology of meningioma.